I will just touch on why the levels are different. Yeah, when you're younger, you have got like children, yeah, female children have very high AMH. If you measure children, the AMH is like 150 normally, yeah, very high, 100, but they do not have they don't, of course, they don't ovulate. They don't have many even follicles on their ovaries. The ovaries very small, but the AMH is high. Why? Because this AMH is being produced from activated follicles, eggs in the ovaries, and that's being produced from pre-antral follicles. They even before the sac is formed, they keep producing AMH. A lot of, because children, of course, have a very high egg reserve. Because let us say if you're born with 1 million eggs, so by the time you reach maybe age of like 30, you may have only like 100,000 left. So 900,000 eggs you lost when you were a child and during teenage years. And those eggs value you're losing, they're producing AMH hormone. Before even they got secondary active, there two activation happens in eggs. Primary activation is when sleeping egg, it wakes up, and it takes 3 months to get to the secondary activation. Secondary activation means once that egg becomes preantral and antral follicle and ready for ovulation. Yeah. So in children, secondary activation doesn't happen. Why? Because pituitary hormone will not be producing FSH and LH hormone in pulsatile fashion. So, and also there's a programmed internal mechanism where these follicles do not become visible, but they do produce AMH. This is why when you measure AMH in children, it's very high, and when you measure AMH in teenage girls, it's very high. When you measure AMH in early 20s, it is high. So even in patients who's going to have a early menopause or diminished egg reserve, they always had a very high AMH. But they were not aware at the time. So let us say when you measure 20 is very high, then it keeps dropping and dropping. Why? Because you have a lesser number of sleeping eggs, and you're activating less number of eggs, and less AMH is being produced from pre-antral and antral follicles. Then as you get older and older, it drops and drops, and it reaches zero, which means it's not detectable on the blood, but still there's AMH being produced from some antral follicle. This way, when you measure in AMH in women with diminished egg reserve, the AMH may be 0.6 picomoliters, but they're still ovulating and they're still fertile. They still can have kids. And when you do antral follicle count on this group of women, you can see like 5, 6, 7 follicles, and they keep ovulating, and that AMH is actually being produced within the ovary, but it's not high enough. It's not going into the bloodstream. A very tiny amount is going into bloodstream, but our test's not sensitive enough to pick up. So this is here you have got like a time period, maybe 1 year, 2 years, 3 years, maybe even longer. In some women, their AMH can be 0, but they're still fertile. They're releasing eggs. They can get pregnant, and which means that's the time they have to really utilize it to maximum to get pregnant. This is the reason why we recommend them not to ignore when they have such a low AMH, because eventually then follicle number drops in such a level, then you have a perimenopause. Perimenopause means still you have 3-4 follicles. You do not ovulate every month. You ovulate every 3-4 months, which means you have a period every 3-4 months. Then periods become longer and longer and longer, then stop, which means menopause. Menopause means if you don't have a period for whole year, and when AMH is zero, and when FSH is high, that's menopause. So which means you cannot reverse that. Yeah. So yes, AMH is very high when you're young. Everyone had high AMH when they were younger. And then it's lower when you're older. Then once you reach menopause, it is AMH 0. All women who had menopause, the AMH is 0.